The Mind Deconstructed, Mental Health and Wellness with Dr. Kaz and George.
I'm Dr. Kaz Nelson, an American Board of Psychiatry and Neurology certified psychiatrist licensed to practice medicine in the state of Minnesota.
I'm your podcast host, George. I'm a licensed attorney in the state of Minnesota, but I'm not here to give you legal advice.
The statements of Dr. Kaz and George are not a substitute for medical care, and our opinions are our own. If you are experiencing a mental health emergency, please seek assistance from a professional.
You can contact us on Twitter at MindDeconstruct. On today's episode, the mental health impact of discrimination.
Hi, George.
Hi, Dr. Kaz. We are recording today from your beautiful front yard.
Yeah, you might pick up on a little road noise, some bird action here.
Some kids playing, perhaps, but that's just the realities of us trying to continue to social distance, even though we are in the same place. We are 7 or 8 feet apart, I would say.
Yeah. Decided it was not safe to record in the studio. So we've got masks on, a few feet apart here in the front yard, recording.
Dr. Kaz, we are in Minnesota.
Yeah.
George Floyd was killed in Minneapolis, not too far from where both of us live, sparking global protest activities, Black Lives Matter movement, kind of reaching a whole new level of awareness within American society. And so we're going to talk about that a little bit in the sense of discrimination and mental health.
Yeah, the topic of us in Minnesota in particular, Minneapolis, taking a good look at ourselves, because I've mentioned on this podcast before my pride in being a Minnesotan, my love of living here, love of the community, my desire to serve the state and the people of Minnesota. Both of us desire to do that, George. But we have to know that living in Minnesota is not pleasant or joyful or fun or nice for everyone living here, that there continues to be rampant effects of racism, discrimination, violence, oppression for people in our community, particularly people of color and particularly Black people.
Just being in Minnesota, I'd like to give a quick shout out to the Mapping Prejudice Project. Have you heard of that, Dr. Kaz?
I have, but tell us.
The Mapping Prejudice Project, it's somewhat unique to Minnesota in terms of where they've started it. It's a group that has taken it upon itself to look through all of the titles of certain areas of Minneapolis to kind of see the history of racial covenants.
In neighborhoods.
Mm-hmm. and the way those racial covenants were used in the 50s and early 60s to keep Black families in particular and other racial ethnic groups out of what would be white neighborhoods primarily. And so these racial covenants would say people can't sell a home to a Black person or a Jewish person or basically anyone other than a white family. And so that had the effect of really grouping Black families into these very small neighborhoods, which were then redlined by the federal government, meaning that they couldn't get home loans for those particular neighborhoods, resulting in just this cycle of poverty, knowing that home ownership is such a important part of kind of generational wealth, and kind of how we're still dealing with the effects of that even after the practice was outlawed in the mid-60s.
That's a great example, George, of how system-based issues, how policies, procedures, institutions, systems, who can get a mortgage, who can't, what those policies are. That's a good example of systemic or system-based racism.
And the simple fact that maybe that element of systemic racism was outlawed maybe 50 years ago, that doesn't mean that the effects aren't still felt.
These aftershocks.
Yes.
Generation after generation.
That's not to say that systemic racism has been abolished throughout the systems.
No, there's lots of examples still, yeah.
Getting specifically to the mental health aspect,
July has been designated as Minority Mental Health Month, and we are just wrapping up July, but perfect timing with everything going on in terms of our national consciousness, our national conversations. There's just another reason why we should have this conversation today about the mental health impact to individuals and communities of this kind of system-based racism and discrimination. First of all, I just want to acknowledge that in previous episodes of the podcast, I do feel, George, that this very issue of some of the nuances that go along with disparities in health among different communities, we have not addressed that enough historically in our podcast.
Okay.
When we talk about depression, we talk about anxiety, we talk about suicidality. I'll just be the first to admit that looking back, we tend to talk about these things as if the symptoms, the diagnosis, the experiences, risk factors are uniform across populations. And that's not true. And I think probably our past podcasts might give an illusion of that being true, for which I think we need to own up to.
We've been speaking more race neutrally
Yes.
when we know that doesn't work in
Right.
terms of everyone's experiences are different, and that does impact them differently, and that needs to be acknowledged in order for people to get a full benefit.
Exactly. I think that's one of the concepts that people like us who are in positions of advantage or privilege structurally within our society, it's been something that we have, in a really problematic way, felt that we can be somewhat neutral on or talk about these experiences as sort of universal experiences. But the truth is, because of the system-based racism and discrimination that's baked within our society, there are mental health impacts to individuals and communities that are disparate. You know, that racism causes harm to people and their mental health, and we haven't discussed that to the extent that it needs to be acknowledged.
So let's get there. How does discrimination impact people?
Well, this has been clearly documented in a number of scientific studies that when somebody is identified as an outgroup or disadvantaged in some way, that causes a form of stress, a form of chronic stress. And stress is not just a psychological thing. Yeah, if somebody treated you poorly, wouldn't that be upsetting? Almost like a psychological thing. Wouldn't that just be a distressing idea? Well, you know from our episodes on post-traumatic stress disorder or acute stress disorder that stress has a direct impact on the body. Stress signals the release of stress hormones, adrenaline, cortisol. These things have direct effects on the biology of an individual. And when many, many individuals experience this kind of stress, that kind of stress can impact a whole community through absolutely no fault of one's own. And so this form of chronic stress, or another term for that is minority stress, has been linked to serious health outcomes, from physical health in terms of the immune system and all the way to depression, anxiety, and other mental health disorders that are linked to stress as a risk factor.
You use the term minority stress. Is that a medical term? Like,
Yep.
if that's an acknowledged factor in a person's history? You know, like if you're meeting a patient and you identify minority stress as a contributing factor to their mental health picture?
Yes, absolutely. And that stress comes in many, many forms, from overt, discrimination, being called terrible names directly, that kind of thing, all the way to subtle interactions, or this has been a popular term in the past several years.
Microaggressions.
Yes, microaggressions,
Yes.
which that is all of a sudden becoming a misnomer too, because these kinds of interactions are not so micro. They are forms of discrimination, forms of racism that have a direct impact to people and their health. And so we're even moving away from the term microaggressions to better acknowledge that these types of interactions do represent racism.
Just in case our audience isn't familiar with them, it's little ways in which white people interact with people of color or other groups to kind of make them feel like the outside group in certain ways, like asking someone that's a different skin color than you, like, where are you from? And, not accepting like Cincinnati as the correct answer, like, things like that. That's probably not the best definition of microaggression, but.
Yeah, not working to pronounce somebody's name, instead calling them Mr. J or something like that.
Yeah, yeah.
As opposed to pronouncing the full last name. These kinds of interactions permeate our society, and there is a cost to these interactions. There is a stress associated with these interactions. And probably one couldn't say that one interaction or two interactions like this could directly be linked to a serious mental illness. But day to day, hour to hour, this kind of stress adds up over time. It takes a toll on individuals and communities.
And that toll, it's almost like a post-traumatic stress response.
Yeah.
In terms of how it affects the person over time.
Yes, it's a psychological and physiological burden that societies place on individuals. That's an additional stress that people in the dominant community, in the dominant culture, do not have that cost. They do not carry that burden of that stress.
So what's the overall cost of that over time? I mean, is it a decreased lifespan? Is it higher incidences of mental health diagnoses?
Yes.
Is it what is it?
Those things you mentioned, infant mortality, pregnancy outcomes, substance use rates, basically any health outcome that is measured, there's going to be a disparity in the dominant culture and a culture that's actively discriminated against. Again, not through any kind of fault of the individual or any kind of natural propensity for that person's biology, but directly because of a social system causing medical and health harms to communities that are oppressed.
And I know this is a wrong answer, and I'm just setting you up to answer it. Could it not be just because a different race maybe just have higher infant mortality as a subgroup, or higher incidences of those things?
Yes, that's wrong.
I know it is. So it's just
that is an example of a form of racist ideology.
Yeah. So why though?
The idea of race being a characteristic that confers different health outcomes in and of itself is being completely debunked right now in medicine. We're in the process of eliminating that idea. Why would we do that? Well, there's no actual medical definition of race. Race is a socio-political designation, and so we can't actually do a blood test and determine what somebody's race is, or do an x-ray and determine what somebody's race is. What about somebody who has an African-American mother and a white or Caucasian father? Medically, what would the race of their child be from a medical standpoint? And there's just no way to define race medically. There's no way to measure it. And so when doctors really have to stop and think, how do you medically define race? We can't. And so there's no way that you could say that somebody, because of the amount of pigment in their skin, would have a higher risk for blood pressure versus someone else based on their biology. When we see these patterns, it turns out that these disparities or differences in health outcomes is a result of racism, not of race.
Wow.
Yes.
That really kind of blows my mind a little bit, but it makes a lot of sense based on what we've been talking about.
Yes.
You mentioned infant mortality rates. The article I remember talked about how infant mortality rates and outcomes for Black women were worse, even if they were, highly educated.
It was independent of socioeconomic standpoint, education.
But not necessarily independent of
racism. Correct.
Yeah.
Correct. Yes, you got it. So this is a very, very, very painful and real and true problem that is directly impacting the health of individuals and our community. And I think in places like Minnesota, we're learning that there's this temptation to think, wasn't that at the time where people were trying to fight for their civil rights? Haven't we moved beyond that? Are we in a society that is beyond discrimination? And isn't it time that we don't have to focus on these issues? Well, that's not what the data show. These issues are real and active today, and we actually have to shift gears, look to identify instances of racism that are built into our societal structures, and actually work to fight and dismantle those systems.
And what is the medical community doing to further that goal?
Thank you for asking. Well, first we are taking a hard look at ourselves, a hard look at our practices, a hard look at the data that show these tremendous disparities in outcome. COVID, is really shining a light on this. The people who identify as Black or African American are dying from COVID at much higher rates than people who identify as white. And it's beyond alarming and distressing to see this disparity play out just right in front of our very eyes. It is so disparate, it just simply cannot be ignored. And so we're taking a hard look at ourselves and saying, how can we be part of the solution? How can we not just see ourselves as neutral allies, but actually work to fight this? And so there are groups like White Coats for Black Lives doing very good work in this area. We're trying to understand the impact of racism on health at a much deeper level. I know there's a lot of education going on, a lot of webinars, a lot of books being recommended, faculty and professional development to help us. And the other thing we can do is discuss this more directly with patients. Our patients know this is impacting them. Our patients know this is going on. And for us to say, well, I'm race neutral and I care for all my patients equally in the same way.
That's just another microaggression.
Yes, it's invalidating.
Yeah.
It's invalidating to people's experience.
Yes.
The problem is we haven't always, particularly in Minnesota, had the insight or the knowledge or the language or, frankly, rates of physicians that reflect the diversity of the community. So that's the other thing we're doing is we're working very hard to foster, develop, nurture, and grow the pipeline of Black physicians and physicians of color so that we have colleagues who can help hold us accountable, who know the impact of this directly and can serve the community in a way that represents the community.
Sounds like it's going to be a long process.
We have a lot of work to do.
Yeah.
A lot of work to do. And we can't let COVID or other things say, well, we have this emergency going on, so we're going to have to put this work on the back burner. No, this has got to be on the front burner. And this pause with COVID and the disparities we're seeing and George Floyd's murder, the combination of these factors, this has got to be the priority. It just has to be. It's gone on too long.
Yeah. Okay. Well, thank you, Dr. Kaz. Thanks for joining me out on your front lawn.
Yeah, we have so much to dive into now, today, and over the next several podcasts. We're really going to be having some good conversations around these issues. So look forward to it.
Yeah, me too. Thank you for joining us today. This podcast was produced by Kaz and George. Music by Paul.
He's the best.
Contact us and send us your questions on Twitter at MindDeconstruct.